I've got a 76-year-old patient who was diagnosed with both arthritis and a meniscus tear in his knee, and he was told he's definitely going to need surgery. But in just 8 weeks of rehab, we got his knee to the point where it was almost totally pain-free and he didn't have to go under the knife. In today's video, I'm going to share with you exactly what we did to fix his knee pain, and hopefully it will help someone watching this at home who's suffering with their knee as well. My name is Will Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham, and I've helped thousands of people with knee pain to improve their symptoms without having to go under the surgeon's knife, and hopefully I can do more of that today. Now, whilst all knee problems are different, many times it isn't necessarily the pathology inside the knee that's causing the pain, it's actually the mechanical forces acting on the knee that lead to the symptoms. Weakness, tightness and stiffness in all areas of the lower leg can contribute to knee pain. But the good news is those issues can often be fixed, which is exactly what a physio like me specializes in doing. And that's how we can usually improve people's knee arthritis symptoms, even though the actual pathology doesn't tend to get better. So this video is perfect for anyone who wants to explore that kind of a natural solution instead of opting for surgery. So to give you some background, my gentleman was a man in his 70s who started with some mild knee pain that slowly got worse over time. He went to see his GP and his GP said, yeah, your knee is very stiff, it's a bit swollen. He sent him for an x-ray and found that the two bones that make up the main part of the knee were quite close together, which means he had at least moderate arthritis, and he had some tenderness along his joint line, which often means the meniscus, which is the little fibrocartilage layer inside the knee, was also probably injured. Now, the GP just said, look, your knee is not in a great way, you're probably going to need some surgery. But instead, my gentleman wanted to try physio first. So that's exactly what we did. And now I'm going to show you what we did step by step. So hopefully it will help you too. So here is the step-by-step plan we used to fix my gentleman's knee pain. Now I'm going to show you the exact exercises that we used and explain why they work. But these exercises are not going to be suitable for everyone with knee pain. So do get checked out before you give them a try. And if they cause you any pain, then just avoid those ones. Now, the first thing I wanted to do with my gentleman was restore something called extension, which is how straight you can get your knee. And when he came to me, his right knee can go totally straight, okay? And that's normal for him. That's exactly what we want. But his left knee, the one that had the problem, was locked in about 10 degrees of fixed flexion. So even when I asked him to straighten it, he still had a little gap between his knee and the bed. So that was my first clue that something wasn't quite right and probably mechanically was causing him discomfort. So the first thing we did is work on his extension. Now, a big part of this was what I did with him in clinic. So I did some mobilizations to help that extension improve, but he did a lot of the work at home, and I'm going to show you exactly what he did at home. So what I asked my gentleman to do was to take a pillow like this. He folded it up in two and put it underneath his ankle like that. So he wanted to rest his leg out in front of him like this with a gap between the back of his knee and the bed. And then all I asked him to do was take two hands, just place them very gently above the knee here, and with only about 5 or 10% of his effort, just push down to try and straighten that knee, and then relax and let the knee spring back up. So push down and up, down and up, down and up, down and up. So he was just passively trying to increase the range of motion of his knee joint. Now, when you're looking at me doing this, you're probably thinking, well, it doesn't look like very much is happening down there. And you're right, I'm putting in a tiny little effort. But over time, those extra millimeters of range of motion do increase. So you're going to get more and more extension. And then when you take away that pillow, you might find your knee can go flatter, because what you've essentially done is you've helped to stretch out your joint capsule, you've helped to stretch out the ligaments there, and you've just helped to ease that joint into a position that's more natural. Now, the reason we're only doing 5 or 10% effort is because for some people, if we do too much, that can be very, very painful. And maybe not at the time, but afterwards, they can really regret it. So start really, really gently. That's very important. Do about 30 seconds worth of work. So maybe 10 to 20 repetitions in a row, and then stop, test it, see how the knee is moving. And if it's increased, you can come back to it again later in the day. Now, I wouldn't go and do 10, 15 minutes of this all in one go, because again, you probably make yourself sore. But once you feel you've got a bit more extension, that's a really good sign. And once we had that with my gentleman, we moved on to the next stage, which is to restore flexion. Before we go any further, I just want to tell you about 3-Tip Friday. 3-Tip Friday is my weekly email that I send out to my list, and it features 3 of the most interesting things I've found that week. It could be a health tip, it could be a piece of research I'm reading, or it could be a new tool that I've found to be really useful for helping people get more mobile. It's totally free. I just send it out once a week. There's no annoying promos inside, and you can sign up for it by going down below this video and entering your email in the 3-Tip Friday link. So the second thing we wanted to do is improve this movement here, which is flexion. Now, when I tested his good leg, he had 140 degrees of flexion on this side, which is really good. But on this side, he only had 110 degrees. So his knee could only get to there, whereas other one could get all the way up. And that made things like climbing stairs and cycling very, very difficult. So to improve flexion, what we did is I got him lying down like this. He got a normal bath towel. He rolled it up into a bit of a band, kind of like this, or a sausage. All right, held it in 2 hands, lassoed the front of his shin, then used his knee muscles to bend the knee, and then gave it a little helping hand with the hands, just until he reached the point of stiffness, and then relax back out. So again, slide up and pull, and then down and release. Slide up and pull, and down and release. Slide up and pull, and down and release. And each time just going into a little bit of stiffness, not right into pain. We don't want to take this to the point where it feels like your knee is going to fall off. We just want to take it to the point where it feels a little bit stiff, and then you let it go again. And this is a really nice way over time to just, again, gain those little millimeters. Every time you're gaining 2, 3, 4 millimeters of movement. And if you do this repeatedly, it only takes a couple of weeks before you start to see some pretty decent gains in your knee range of motion over time, particularly if it's been very, very stiff. So after we did 2 to 3 weeks of that, he'd regained back to 140 degrees of knee flexion on this side. So a massive improvement. Now, for some people, it might not be that fast. For others, it could be even quicker. But that was a really good result. And that meant the next thing we could do is move on to building his strength. So I noticed the first time I tested my patient that he was reasonably strong all over, but his quads, these muscles here in the thigh, were comparatively quite weak. And he was 76, so he wasn't an old man. He should still have nice, strong quads. So we decided to build up his quad strength. The problem was he still had pain in his knee. So doing things like squats or sit to stands even were quite painful. So we had to choose another way. So what I gave him was a straight leg raise against a resistance band to build up his quad strength without making him weight bear on his leg. So the exercise looks something like this. We're going to use a small resistance band wrapped up into a loop like this. You can tie it reasonably tight, but it doesn't have to be a tough band. This is a nice flexible one. And then we just put it around both ankles like this, and then let the legs lie down nice and flat. Now, first thing we had to do is just tuck the lower back down into the bed just to protect against any back problems like this. Then this leg here, the right leg, acts like an anchor. So you dig that one down into the bed, and with the one you're working, you pull the toes up towards you and then lift the leg up in the air and then slowly back down like that. So up, 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 up into tension. It gets harder the higher you go, and then slowly back down. And then up again into tension, and then slowly back down. Up again and down. Now, I asked my gentleman to keep doing this until he reached the point of fatigue. So he kept working on this movement until this muscle here, the rectus femoris we call it, started to get tired, and he felt he couldn't do any more without either his back popping up or his knee bending like that. And when he got to that point, he would stop and rest. He would take 1 minute's rest, and he'd repeat again and he'd do the whole thing 3 times over. So by the time he finished, he had quite a bit of a working ache here. I asked him to also repeat it on the other leg just to make sure things were even. And that ticked off his range of motion in both directions and his knee strength. And over a period of a few weeks, those quads became strong once again. The final thing I worked on with my gentleman was his walking. And walking was his favorite hobby. So having knee pain really did get in the way of that. And when I watched him walk, I found that he was kind of limping. He was putting his toes down first, and then he would limp like that because his knee didn't feel strong enough to keep him nice and stable. Now, as he got stronger, the walking naturally improved. But I noticed that he was still having this tendency to put his foot flat or put his toes down first, and then a slight limp would follow. So what we did as a final stage in his rehab was worked on heel to toe gait, which looks something like this. You're prioritizing putting your heel down on the floor first, and then you go onto a flat foot, and then you push onto your toes like this. I'm going to show you on the left leg, which was his problem leg. His heel would go down first, then go flat, and then push off. Now, the reason he wasn't doing this to begin with was because it was painful. But as the problem started to improve, it wasn't painful anymore. It was just a bad habit. So we worked on reintroducing this kind of walking. Now, the thing that worked for him was just saying in his head, heel, toe, keeping that rhythm going in his head every time his left leg was coming forward and striking the ground. So he didn't have to say it for his right as well. That would just follow suit. But it was like this, heel, toe, heel, toe. Okay, so every time the left leg moved, he would have that mantra almost in his head as he was walking. And then after about a week and a half, that just became automatic. So he didn't have to do that forever and ever. It's not like you're going to need to keep doing that for the rest of your life. It's just to solidify it back into almost a natural habit, and then you can stop doing it. So if you are struggling to walk, give that a try, because that will hopefully help to reduce the pain. So that's exactly how I helped my 76-year-old patient beat his knee pain. I hope you found this useful and you can apply the advice to your own life. If you find it useful, do drop a comment below. And equally, if you try this stuff and it really worked, come back and let us know, because it does help us to improve these videos for you guys in the future. If you want to get more advice and exercises and things that will help you improve any case of knee pain, then one of the best things you can do is grab a copy of my brand new book, Thriving Beyond 50, the 2024 edition. It's got loads of exercises and advice and guidance inside to help you fix all manner of problems, including loads of bits and bobs about knee pain. So if you grab a copy, I hope you really enjoy it. Anyway, thank you so much for watching, and I'll speak to you again on the next video.